How can we look at the whole person and understand what's going on so that we could build and actually change the whole person? And so that's where we came up with the omics, the GI map, and the Dutch Plus. So we are looking at hormones and energy, and we're looking at the gut biome, and we're looking at the organic acids and how you're utilizing the things that you're putting in your body. And so each one of those stack on top of each other. When you look at that as a whole, you get a beautiful picture of what's going on in one person's body at that time. And so then we use that as our guideline to addressing an individual's needs. Most of the time they come in because they're tired, they feel bad, they hurt, they can't sleep, they are overweight, and they don't know what to do about it. So we start there. We always start at hormones. So everybody that comes in has an imbalance in their hormones, whether that be their sexual hormones, their thyroid hormone, their adrenals, whatever that is. Hormones are a big deal. And so we start there. They feel better. They get more energy. And then when we get them to feel a little better, then we start addressing the gut. Then we start addressing toxicity issues and things like that.
The majority of patients that we see are chiropractic patients. And so if somebody comes in with low back pain and they say, hey, I got low back pain, but I didn't have an injury, I didn't have back pain when I was younger, this all just kind of started. When people have deficiencies in hormones, you have joint pain. So that's how all of this ties together. So chiropractic patients, we have slowly over time said, hey, if you're not sleeping, you really need to check your hormones. And we tell people to go to their medical doctors and do stuff. And the medical system doesn't like to deal with what I call the slow burn, that slow decline.
And to give an example of that, for men and women, but men get theirs addressed earlier. It's never ignored when we talk about hormones. But in their 40s and their 50s, or maybe even late 30s, they start slowing down, or they're tired, or they start having specific issues, and then they ask about it. And that's where you get well, you're just coming to that age, and that is a cop-out. It's a cop-out, especially for females, because if a man would walk into the same office, a man would always get his testosterone not necessarily optimized, but brought up to normal. Whereas a female walking into an office, they would just be like, well, you're at that age, things are changing. And that's where we have to start changing the way we look at things. Each person, male or female, should be optimized.
We do this because we want everybody living their best life, because we know that if we have everybody doing well and people are productive and they're happy and our communities are thriving, so we start with ourselves and we start building ourselves up.
It then ends with that. So we treat one person. Mm-hmm. You help that person feel better or optimize their lifestyle, and that trickles out to their immediate family members or their partners, which trickle out to theirs. And so you really are changing communities.
And then we start to get in where I'm really passionate about, which is the microbiome and the biochemistry that's happening in the body. How do we make somebody resilient? Functional medicine fails when we as functional medicine providers treat it like allopathic medicine. When you give pill for an ill and you really don't take time to sit down and learn the person as a practitioner, when we look at everything and start to point people into the directions that actually gets them health and healing, and then we work on foundational biology and health, and we deal with the microbiome, and we get your body healthy so it can detox, well, then we have people that go from 187 symptoms down to 3. And so what we want to do is teach you about yourself. And that's that's why we do what we do.